is Dr. Sanjay Kumar Chaudhary. I am Senior Consultant Neurologist at Institute of Brain and Spine, Lajpat Nagar, New Delhi. I have been working here for the last 5 years. I have a vast experience of 22 years working in the field of neurology. I have worked previously at multiple tertiary care neurology centers. Right now, I am going to talk to you about paralysis. Paralysis is basically the motor weakness of any one limb or all 4 limbs. It can be also one side of the body. Paralysis means weakness. Weakness is mainly motor. It is mainly caused by an insult or injury to the brain or spinal cord. If there is a trauma, if there is a reduction in the blood flow to the brain, or if there is a bleeding in the brain, then you have paralysis. Paralysis can involve, as I said, it can involve any one part of the body, like face. So it can be a facial paralysis. It can be in one arm, it can be in one leg, or it can be in one whole left or right side of the body. Rarely, if the damage is extensive, it can be involving both the lower limbs, or both the upper limbs, or all 4 limbs. Because of this, there is paralysis. Paralysis sometimes can not only be in the limbs, it can also involve the bladder and bowel functions, especially if it is a paraparesis or paralysis of both lower limbs. Paralysis of upper limbs rarely cause any bladder and bowel involvement. The types of paralysis can depend on the cause. It can be involving either the face, or it can be one of the few muscles of the eyes, or it can be in the hands, or it can be in the legs, or it can be multiple combinations like left side of the body, or both the lower limbs, or it can be both the upper limbs, or it can be all the 4 limbs. Apart from this, the causes of paralysis can be either trauma. Commonly, it is because of accident, because of trauma to the brain or to the spinal cord, like in road traffic accidents, or gun injuries, or bullet injuries, or because of assault by any blunt object like stone, or by any sharp objects like any hammer, or it can be because of knife or different sharp items. The damage to the brain and the spinal cord can also occur because of reduction in the blood flow to the brain, which we call ischemic infarct. So it can either be ischemic or it can be hemorrhaging. If there is ischemia to the brain, there can be infarcts in the different parts of the brain. The different parts of the brain are subserved by different arteries, like they can be an anterior cerebral artery infarct, it can be a middle cerebral artery infarct, or it can be a posterior cerebral artery infarct, or it can also be a combination of more than 2, especially if it is an internal carotid artery infarct. Apart from the infarct, it can also be a hemorrhage. The hemorrhage can result because of 2 reasons. Either there is a hemorrhagic transformation of the ischemic infarct, or rarely it can be because of a rupture of an aneurysm. An aneurysm is an abnormal outgrowth in the artery supply to the brain, resulting in subarachnoid hemorrhage. Sometimes the bleeding can be within the parenchyma of the brain, resulting in paralysis. Apart from this, other causes can be because of tumour in the brain. They can be because of either a worm in the brain, like neurocysticercosis. They can also be because of any infective process like tuberculoma in the brain, a gland, or because of even cancerous items, like it can be because of a lymphoma, it can be because of leukemia, which infiltrates the brain and causes occlusion of the arteries, causing occlusive infarcts. because of vasculitis. Very rare cause is primary CNS vasculitis. Rarely, it can also be a manifestation of secondary vasculitis from other connective tissue disorder involving other parts of the body. So, apart from this, there can be multiple rare causes. I will not go into the details of them. So, first thing is we have to treat the cause. For example, if there is a tumor in the brain, that tumor has to be operated upon. If there is a hemorrhage within the brain, the hemorrhage has to be taken care of, and sometimes we have to go for drainage of the brain hemorrhage. Either it is a subdural hematoma or sometimes it's subarachnoid hemorrhage. If it is caused by an aneurysm, the aneurysm has to be clipped or it has to be coiled. Apart from this, other treatment options include, for example, in ischemic stroke, we have to give clot busters. The clot busters are to be given within the first 4.5 hours if it is by an intravenous route. Rarely, if it is because of arterial infarct, in which a patient has come to us after 4.5 hours, we can still go for an direct angiography followed by a mechanical revascularization procedures within 6 hours. Rarely in posterior circulation ischemic stroke, we can go for mechanical revascularization even after 6 hours up to 18 hours, depending upon the individual clinical scenario. Apart from this, the vascular causes of ischemic stroke, the other causes which we need to treat depends upon whether there is edema, then we have to give decongestive measures. And apart from the medical measures, the main important is the rehabilitation, which includes physiotherapy, and we have a novel physiotherapy model known as CyberDyne. For helping the patient walk after paralysis, we ask them to strengthen the muscles of the legs, and they need proper posturing. Sometimes we need to give them splints. And apart from this, the CyberDyne is a very special mechanism and procedure in which regular biofeedback therapy is given by robotic assisted measures to help in the rehabilitation and making the patient walk, especially after paralysis.